Okay, good afternoon, everyone. We'll get started in just a couple of minutes. Okay, good afternoon again, everybody. Thank you so much for being here. Welcome to the Hypertensive Disorders Equitably Addressed with Remote Technology for Birthing People, or Heart BP information session. I wanted to first let you know that this event is being recorded and will be posted publicly to the HPC's webpage. And we're very excited to have you here. My name is Taylor Bungo. I'm an associate director at the Massachusetts Health Policy Commission and one of several folks who have helped to design the Heart BP program. I'm joined behind the scenes by my colleagues Becca Schwartz, Hadassah Charles, and Kelly Hall. The goal of the information session today is to help you understand the Heart BP investment opportunity and requirements as outlined in the Request for Proposals document that the HPC issued earlier this month. The RFP is posted on the ComBuy's website, and we highly recommend that you carefully review those documents and attachments, which include all of the key details and requirements. Today, we will emphasize key points contained in those documents and clarify some information as well. Today's information session will end approximately at 1 p.m. And as an overview, we will be covering the highlights related to funding and eligibility, application requirements, review and selection criteria, and important upcoming dates. We also hope to have some time at the end to answer questions. If you have any questions during the session, you can submit them through the Q&A chat function in the webinar. And if you have questions that come up after this session, you can email them to hpc-heartbp@mass.gov. During the Q&A portion of the session, we may be going on mute periodically to confer about the appropriate responses, so please bear with us at that time. And any questions that we don't get to today, we will answer and post to the FAQ document on ComBuy's. The Heart BP program is a $1.5 million investment opportunity to support eligible entities in making high-quality, patient-centered remote blood pressure monitoring programs. Heart BP will be making 5 awards in total, with up to $300,000 of funding available per award. Heart BP aims to support remote blood pressure monitoring programs for a minimum of 6 weeks postpartum. We also wanted to allow for some flexibility in program design, so awardees may choose to start their programs earlier than delivery and/or continue patient engagement beyond 6 weeks postpartum. In addition, the program will aim to improve access to care, experience of care, and outcomes for birthing people experiencing hypertensive disorders of pregnancy. Heart BP also has an explicit equity focus that is reflected throughout the RFP. Awardees will be required to address the presence of or potential for inequities in all elements of the program. Heart BP also intends to measure the reduction in avoidable readmissions and ED visits associated with hypertensive disorders of pregnancy and capture insights on processes, outcomes, experiences, and avoided costs to support sustainability and scalability beyond the life of the grant period. To achieve these goals, there are several key program components required for proposals. Proposed programs must provide wireless remote monitoring with telehealth follow-up for enrolled patients. In alignment with the focus on equitable care delivery, awardees will be required to collect race, ethnicity, and language data to track any emergent inequities and act on them. As mentioned on the previous slide, there is not a one-size-fits-all model for use of remote monitoring for hypertensive disorders of pregnancy, so we want to leave reasonable latitude for applicants to propose models that make sense in their particular context. That said, at a minimum, applicants must propose programs that have the capacity to support appropriate patients from birth through 6 weeks postpartum, which is the period of greatest risk for SMM, or severe maternal morbidity and mortality. In addition, awardees will be required to engage patients and people with lived experience in program design and improvement. Finally, proposed programs should offer culturally and linguistically concordant education and training to successfully manage their HDP and use the virtual technology tools. As mentioned earlier, a total of $1.5 million will be available to support 5 awards of up to $300,000 each. 4 of the awards will be made from the Distressed Hospital Trust Fund, and 1 award will be made from the Payment Reform Trust Fund. This combination of funding streams will allow us to direct the majority of our efforts towards distressed community hospitals, but still leave some funds available for applicants who are not DHTF eligible, but are well positioned to achieve the goals of the program. In addition to the programmatic elements required, awardees will also be expected to report quarterly on a set of quantitative measures. These include, but are not limited to, demographic characteristics, process measures, and several outcome measures. Awardees may also propose additional measures they wish to collect that are particular to their context and patient populations. Qualitative data will also be an important component of Heart BP. Awardees will be expected to participate in patient experience evaluation activities and staff and/or clinician experience assessments. Please refer to the RFP posted on Combis for further details. Finally, applicant proposals will be evaluated on several factors, including proposed program, applicant characteristics, measurement and data, health equity, proposed budget, and sustainability/scalability. I will call out a few highlights from the criteria, but again, please refer to the request for proposals available on Combis for a complete list. The proposed program section comprises 30 points. We will be evaluating submissions based on clarity of program goals, feasibility, and potential to generate insights about cost, outcomes, and patient experience. The applicant section is worth 20 points. Alignment with the communities of priority identified by AHEM, or Advancing Health Equity in Massachusetts, will be considered, as well as financial health and demonstrated need. The measurement and data collection section will be worth 10 points and will be assessed on the proposal's plan for data collection and analysis, including the appropriateness of time allocation from staff who are dedicated to measurement activities. As mentioned previously, health equity is a priority of the Heart BP program, and this section will be scored out of 20 points. We'll be looking at applicants' demographic makeup to ensure service for populations who experience a disproportionate prevalence of hypertensive disorders of pregnancy. We will also be assessing the feasibility of the proposal's design for collecting and analyzing data stratified by race, ethnicity, and language. Finally, we will evaluate the applicant's approach to capturing and integrating patient feedback into program design and implementation. The second to last category is budget. The program will be reimbursement based, and we will be evaluating the budget for appropriate allocation of resources to support the proposed program. Finally, the HPC is committed to investing in programs whose impact extends beyond the life of the grant period. To that end, there will be 10 points allocated to the sustainability and scalability of the proposed program. As we near the end of the information session and get ready to transition into the Q&A portion, I want to highlight some important dates coming up. Please submit any additional questions about the RFP to hpc-heartbp@mass.gov by August 2nd. The deadline for proposals will be September 6th at 5 p.m. We plan to make a public announcement about awardee selection on October 10th, with a January 1st start date for program implementation. Okay, now we've arrived at the portion of the information session where we'll be answering some questions you have submitted through the webinar chat. And in just a minute, I will be passing the mic to my colleague and Senior Director of the Healthcare Transformation and Innovation Team, Kelly Hall, who will orient you to the process for this Q&A portion. Kelly?
Thank you so much, Taylor, and thank you to everyone who's made time to be here today. We're very enthusiastic about the Heart BP program, and we look forward to answering as many of your questions as we can today, and if not today, certainly via the FAQ document in the future. So as Taylor said, let me just provide a very brief orientation to how we're going to handle the Q&A session. We will, as she mentioned earlier, we will be fielding questions from the chat, and in some cases we'll be able to answer them immediately. In some cases, it might require a little bit of conversation to try to get you as clear an answer as we can. If that in those circumstances, we will put ourselves on mute and we will try to be expedient in answering the questions so we don't waste your time. But I would appreciate it if you would bear with us as we do that consultation. There may be some questions that we just do not feel equipped to answer today, or we don't want to answer on the fly. We don't know what you might throw at us. So if you throw us something really creative, what we may do is just defer for now, take it back, and address the question in the FAQs. So with that, I am going to take a look at what's in the inbox and try to answer the first question. Okay, so it appears that the first question is related to a selection factor regarding the AHEM communities that Taylor mentioned. The question specifically being whether the applicant hospital needs to be in one of the geographies that is identified by AHEM, or whether it's the patient population served. So let me answer that in two ways. Number one, just to be 100% clear, that is a selection factor, meaning it is one of the things that we think about in evaluating the proposal. And as Taylor mentioned, that is, each of those sections is weighted. So it is a consideration. It is not a requirement. So that's point number one. Point number two is the intention here is to really focus on the patient population. And we do have data here at the HPC that can help us as applications come in, understand things like service area. We did our best in the operational response template not to ask you to provide information that we can get ourselves, just to try to make the application burden a little bit lighter on folks. So when we review applications and we assess that particular factor, we will look at the primary and secondary service areas of applicant hospitals. All right, let me check my inbox again. Hold on. So there's a related, there are a couple of questions, it sounds like, related to related to eligibility. And I realize the trust funds can be a little bit confusing. So and let me try to do my best to explain. So as Taylor mentioned, there are two sources of funds that provide us the money, frankly, to invest in remote patient monitoring through Heart BP. There is, for the Payment Reform Trust Fund, any organization that meets the definition of eligible entity is welcome, entitled to funds from the Payment Reform Trust Fund. The Distressed Hospital Trust Fund was created by statute and has a certain set of requirements. And rather than spend your time today explaining what those requirements are and the rationale for them, I think it's probably easier to just direct you to the attachment that lists those eligible organizations. So I think that the easiest way to think about this is that any organization that meets the definition of an eligible entity absolutely can and should consider applying for funding through Heart BP. There are simply more funds available to invest in Distressed Hospital Trust Fund eligible organizations. Okay, all right, here is another question regarding eligibility. It's a little bit dense, so I'm going to put myself on mute for a second and take a look. Bear with me, I will be right back. All right, we're back. So this is a question that potentially could be most relevant to applicants that are part of larger systems. I'm going to read this question because I think the whoever submitted it very nicely and it's very clear. So give me a minute. The question is this. Let's see, we provide outpatient obstetric services on the hospital campus, but not deliveries, which happen at our central hospitals. Are these community hospitals eligible if deliveries are not happening on site? The answer is if the applicant hospital, so if that is a community hospital, if it's a birthing center, if the applicant organization is eligible for funds, that you can apply for and receive funding through Heart BP. What we would ask you to explain in your application, and this is sort of teased out a little bit in the operational response template, is what is the nature of the relationship and the partnerships necessary to execute on your program. So if that makes sense. So meaning if I am Community Hospital A and I am eligible for funds through the Distressed Hospital Trust Fund, I, as Community Hospital A, will enter into a contract, if awarded, with the Health Policy Commission to deliver a program. I may, through that program, enter into partnerships or collaborate with, or even vendor relationships to execute on that program. And we have, areas of the application where you can explain that. But the funds will flow to the hospital that applied and the hospital that has a contract, or I shouldn't say hospital, the organization that has a contract with the Health Policy Commission. So I know that that's kind of a complicated answer, and we will address this again, or we'll make sure that this particular question makes it into the FAQs, because I realize it is a little bit of a nuanced one. So if you didn't get it 100% in this conversation, we'll make sure to follow up. We now have a question about the budget, which is specifically, can funds be used for personnel and salaries? The answer is yes. There is an attachment to the to the request for proposals that include, it is a budget template that includes detailed instructions for how to complete the budget and what services are covered and what types of services are covered. But the short answer is yes. There is a program question related to what kinds of technical assistance will be provided to awardees, and has the HPC already selected technical assistance providers? Let me just say, I think that's a great question. I think the answer is, I think we're still working it out. And we would like to develop the TA in such a way that it will be responsive to the needs of the awardees. So the fact that we don't have a hard and fast menu of technical assistance is really a reflection of the fact that we don't know exactly who the awardees will be and what their needs will be. I can tell you a couple of things with regard to potential TA partners that are also addressed in the RFP document. The first is that we have had, throughout the process of developing this program, a very constructive and very productive relationship with the Perinatal Neonatal Quality Improvement Network, or PNQIN. And we fully expect to continue to engage with PNQIN and to work with them to provide support for applicants, for awardees as the program unfolds. So to the extent that you think about that as TA, I think you can expect to be doing some work with PNQIN. Also addressed in the request for proposals is an opportunity to participate in Speak Up training. That is not a requirement of participation in this program, but we think it's an excellent program with an excellent curriculum that we are happy to fund through this program, not as a line item as part of an individual budget, but as a benefit for all attendees. As for other technical assistance, as I said, we will help shape that as we understand who the awardees will be and where they specifically need help. There is there's a quick question regarding some process matters related to this presentation and where you can find the information. I believe we will be uploading these slides to Combise. And in fact, what I would advise anybody on this call is if you are interested in the latest and greatest on heart BP, your best source of information is Combise. If we get a question, we add it to the FAQs. We are doing our best to update the FAQs at least once a week so that they're pretty fresh. So a lot, before you even reach out via the email address, you might take a look at the FAQs and see if somebody has beaten you to the punch. If not, we very strongly encourage you to take advantage of the Heart BP inbox and direct your questions to us. And again, we will take those questions and we will include them on the FAQs. There is another question regarding technical assistance. Do you anticipate releasing an RFP to procure additional TA vendors? The answer is TBD. Okay. We also have a question here. Sorry, this gets back to another selection factor. Just wanted to be really clear about this. As Taylor mentioned, we very much view this as an equity-oriented investment program. And there are, in our health equity selection factors, there is consideration of the representation of Black non-Hispanic populations as a consideration. But just to be 100% clear, there is no threshold, there is no percentage requirement. It is just another aspect of our evaluation of potential applicants. In this case, just to ensure that as we consider who it will receive funding under HART BP, we're recognizing the populations that are disproportionately experiencing the impact of hypertensive disorders of pregnancy and severe maternal morbidity. I'm continuing to scroll through questions here. Can an academic medical center apply? An academic medical center can apply. However, the only funds that would be open and available to an academic medical center would be the funds that sourced from the Payment Reform Trust Fund. The Distressed Hospital Trust Fund includes a specific exclusion for academic health centers. All right, I'm gonna pause here and see if more questions are coming in. I feel a little bit like I should say operators are standing by. Okay, so we have no additional questions right now in the chat, but I am going to pause for a minute. I'm going to put myself on mute and take down my video. But I want to give folks another few minutes to consider whether they have any other questions or they'd like to take advantage of this opportunity to put anything else out there. So 1 second, please. Okay, thanks so much for waiting and continuing to submit questions. So we have another question as a follow-up to the question about the academic medical center. We have a follow-up question about how an academic medical center can figure out what funds are available. Just to reiterate what Taylor mentioned earlier and what is in the request for proposal, there are $1.5 million of funds available in the total program, up to $300,000 per awardee. We have one award funded through the Payment Reform Trust Fund, which means one award of up to $300,000 is open to any organization that meets the requirement of eligible entity, including an academic health center. The remaining funds, up to $300,000 each for 4 awards, are limited to the Distressed Hospital Trust Fund. There's a very specific question. I'm not going to name the individual entity reference, but I think it's express this as a more general question, which is, if you are part of an academic health system, does that mean that every organization in your system is considered an academic health center and therefore not eligible for DHTF funds? The answer to that is no. And again, I would really encourage you, trying to parse the language of the Distressed Hospital Trust Fund is a little bit complicated if you're not familiar with it. The best way to know which entities within your system might be eligible for this program is to go to the attachment that lists eligible entities. That will take the guesswork out of it. Okay, there is a question about learning collaboratives for awardees. We love those kinds of questions. We love learning collaboratives. I think at this point, it's probably premature to answer that question directly, but I think that does fall very squarely into the response I gave with regard to technical assistance, specifically that we will try to understand the needs of the awardees and design that technical assistance accordingly to support them. And if there is a demand for learning collaboratives, I would be surprised if we did not try to meet that demand in some way. Okay, there is a slightly technical question about information regarding eligible organizations, specifically asking if we have direct links to the eligible organizations and for the two trust funds. Again, let me just reiterate, the Payment Reform Trust Fund is open. That one award of up to $300,000 is open to any organization that meets the definition of eligible entity. You can be an academic health center, you can be a community hospital. It doesn't matter. That Payment Reform Trust Fund is pretty unrestricted. The Distressed Hospital Trust Fund does have restrictions, and if you go on Combis, which again I would say is your best source, you will see there is an attachment A, Exhibit 2, that lists who is eligible. And that is probably the fastest, easiest way for you to get that information. If for some reason there's any change, there's any addition to that list, it will be updated in Combis. And I believe announcements are made, or there's that there are notifications when something changes on Combis. So continue to check that. I'm looking for another. Let me put us on pause for 1 second. Okay, sorry. Apologies for putting myself on mute again. There is a question here we had a little bit of trouble interpreting, but I think we understand it. I believe the question is coming from a vendor of services, potentially a technology platform or other platform that is geared towards supporting BIPOC patients. And the question is whether we are able to connect that organization to organizations, to health systems that might be considering applying for HART BP. The answer is no. We do not broker relationships between applicants and vendors of service. And the truth is, we don't know who applicants are until we receive the application. So that's just not even information we have. But I would say the information about who is eligible for the Distressed Hospital Trust Fund is public information. It is on Combis. Anybody can see it, but we do not play a role in connecting any kind of service vendors to applicants or to awardees. Oh, we have a question regarding measurement. Will awardees be required to analyze claims data? I'm struggling for a minute right now to think about the context in which claims data would be helpful to the measures. I'm going to have to get back to you on. That's not one that I feel comfortable answering off the top of my head, and I would not want to give misinformation. So check the FAQs, and we'll try to answer that one there. Okay, again, I'm gonna put myself on pause for a minute again and take myself off video and give you all a moment to think of any other questions you have. Maybe if I stop talking, people will be able to let their brains work. So let me put myself on mute, and we'll be right back. Okay, we are back. We have another measurement related question, specifically whether measurement specifications will be released in advance of the grant due date. The answer to that question is no. Typically, we do understand this is not our first time making investments, and we do understand that different organizations have different capabilities with respect to data and different resources. Typically, our process is to include the kinds of measurement information that we included in the RFP to make sure that applicants are aware of what we're going to be asking for. But usually we handle the details of measurement specifications after awardees have been selected and during the contracting process. In other words, once you have learned that you are going to receive a grant, we spend some time with you to help figure out how we are going to work together to meet the measurement requirements. And it's during that process that we would finalize the measurement specifications. Okay, so there is another eligibility question. And it says, could we restate one more time what the eligibility means? And the specific question is, if your hospital is not on the DHTF list, are you still eligible? The answer is yes, you are still eligible. And the total amount of funds available to non-DHTF hospitals are limited to $300,000. But you are absolutely still eligible to apply if you meet the definition of an eligible entity. We have a process question as well. Will we be including these responses in upcoming FAQs? Yes, we will. We will also, as I believe Taylor mentioned, there will be we have a recording of this session, and we will be posting that on our website, not on Combis, as well. And so if you want to spend another hour of your life listening to our voices, you may listen to it again, and it will be all there for you to hear directly. There's a question about explaining how the priority geographies come into play in eligibility. For example, what if a hospital service area has multiple communities and only one community of many is on the list? Again, I want to reiterate The priority geographies is not an eligibility question. There is not a requirement that you serve one of those communities as in order to receive funding through this program. It is a consideration, and it is a consideration among other many considerations in terms of how we assess different applicants. So, for example, what if a hospital service area has multiple communities and only one community of many is on the list? I'm not really sure that I can answer that question in the abstract. It would really be a question we would consider as part of the totality of the selection factors related to the applicant. Another question regarding funding: is there only one non-DHTF hospital eligible then at $300,000? There are $300,000. There is one award available to any organization in the Commonwealth that meets the definition of eligible entity. So the answer is yes. It's not that one DHTF hospital is eligible, it is that one pool of funding is available, and that pool of funding is up to $300,000. All right, I'm putting myself on mute again. We'll see if we get any final questions. And as I said, please don't assume that this is your only bite at the apple in terms of questions. The FAQ or the web that we will be entertaining FAQs and posting FAQs into August. So, as I said, continue to check and continue to send your questions our way. There's a follow-up question regarding funding. Is each hospital awarded $300,000? The answer is each hospital has an opportunity up to $300,000. We will make an award based on the proposal that the applicant submits and the budget that they attach to it. So, making this very, very plain, if you submit a proposal and you have a budget of $287,000, we will fund $287,000. If you submit a proposal and a budget of $325,000, the maximum amount we will fund is $300,000. We have a question regarding the budget, and I just again want to draw people's attention to the budget attachment to the RFP and to the budget template instructions. This question is specifically with respect to indirects. We do not fund indirects as part of this program. All right, I'm not seeing my colleagues enter more questions, but I don't want to, shut down this opportunity for if folks do continue to have questions. So I'm going to put myself on mute and stop my video for a bit and give you a few more minutes to pose questions. If by 12:50 there are no additional questions in the inbox, we will call it a day. So you have about 4 minutes to submit final questions. Okay, so we've had a few more questions come in. Let's see here. Okay, one processy question, like, is there an ETA on when the slides will be posted? Yes, there is. We will post the slides today to Combis and also on our website, so you'll have access there. It's going to take us a couple of days to write up the FAQ responses, so you can look for those early next week. There's an additional question. Can we submit questions after today's session? If so, what's the process? Absolutely. You can submit questions after today's session. There is listed on, or Taylor walkthrough and in the slide deck is a link to our website, or not our website, excuse me, our email inbox. It's hpc-heartbp@mass.gov. And you are welcome to submit questions there. As I said, we will be leaving that mailbox active and open for questions until August. So definitely take advantage of it. Let's see, an awardee selection question. Let's see. Whoops. How many awardees will be selected from each pool? I'm not sure that pool, like characterizing the pool is based on the awardees is quite accurate. That the pool is the funding pool. So right now, if just using math, if we are willing to fund grants up to $300,000, then that would mean that there are essentially at 4 slots available for hospitals that meet the criteria for the Distressed Hospital Trust Fund, and 1 slot available that's kind of the less restrictive, open to anybody fund. Okay, so that would mean the total number of awards is 5. 4 of them limited to the DHTF, 1 of them open to anybody who meets the criteria for eligible entity. There's also a question/comment, and it's one of you is noting that what you're not seeing on the HPC site is the outcomes reporting examples that were on the slides. If you go into the request for proposal, and if you give me 2 seconds, I will tell you exactly the section. There is a measurement section that actually lists, it's section 4, measurement and reporting, that actually lists in greater detail the measurement expectations. So that is here again, that the RFP is on Combis. It is in the document. So if you do a little bit of digging, it'll be there for you with some additional detail. Okay, I'm going to put myself on mute again and take the video down, and we'll continue. We'll stay on until 1 o'clock, or until we have no more questions. So again, I'm going to put myself on mute and take down my video, but that should not indicate that we're not still taking questions.
Sure.
So because we are a multitasking kind of an organization here, I'm going to answer a question that actually came into the Heart BP inbox as opposed to the one that came in through the FAQ channel, or sorry, through the chat today, because it is relevant to this question about eligibility. So the inquiry says that they were curious as to whether their organization was eligible because they didn't see their name on the list, and they would like some confirmation. I'm not going to answer this specific question for this specific organization, but again, and we will address this in the FAQs, because it feels like there's a bit more mystery around eligibility than we thought. But what is included in the RFP in Attachment A, Exhibit 2, is a list of the Distressed Hospital Trust Fund eligible hospitals. So if you do not see the name of your institution on that list, what that means is you are not eligible for up to one of the 4 awards that we intend to fund through Distressed Hospital Trust Fund dollars. But you would be eligible, assuming you are an eligible entity, you would be eligible for that 1 award that is funded through the Payment Reform Trust Fund. So I think that, my advice to you would be to first ask yourself, are we interested in applying for this program. And, if the answer is yes, then submit an application. And I realize that's easier said than done. I know these things take time and resources to complete, and I don't take that lightly. But there is that non-restrictive or less restrictive award opportunity, so that I would not conclude that if you do not see yourself on the DHTF eligible list, that you shouldn't bother. There is that, that, as Taylor mentioned in her remarks, we did add that additional funding stream to try to create some opportunity outside of the Distressed Hospital Trust Fund. All right, with our remaining 4 minutes left, I'm again going to put myself on mute and take down my video, but please do submit any last questions. Otherwise, we'll plan to wrap up at 1 as promised. All right, it is 12:58. I'm not seeing any additional questions rolling into the Q&A here. So I'm going to conclude that for the moment we are done. I mean, again, just to reiterate, this is not your last bite at the apple in terms of questions. If you need clarification, or if you need more information, please take advantage of the email inbox, and we will do our best to respond promptly. Please take advantage of the documents we've already posted on Combis. They really are more comprehensive than any kind of remarks that either Taylor and I could deliver today. I mean, we try really hard to be very as clear and explicit as we can in these requests for proposals. We know we don't always succeed. We do our best, but they are the most important source of truth on the expectations and the requirements of this program. So I do encourage you to take a few minutes to run through there. So again, let me thank you very, very much for your interest in this program. As I said, we feel very passionately about it and look forward to seeing as many applications as we see. I hope it's a lot, and to hopefully work with some of you in the future. So again, thank you very much for your time. Thank you to my colleagues who've helped get this event up and running today, and we will look forward to hearing from you. Thank you very much.